Introduction 3.
In the lecture today, I'm going to talk about the different stages of Alzheimer's and how these can be recognised in the patient. Alzheimer's is a disease which affects mental, cognitive and motor ability and ultimately often leads to the death of the patient. It also causes considerable distress to the patient themselves and to their carers. There are 5 distinctive stages to Alzheimer's, and we will now look at each of these stages in turn.
Unit 1, Lesson 1.4, Exercise E, Lecture 3.
In stage 1 of the disease, the changes are very similar to those which occur with the onset of old age. For example, short memory lapses, mild word aphasia. Not being able to think of the correct word. Not being able to find everyday items such as glasses and keys. Even though the individual notices some decline in cognition, it is not noticed by those around them. At this stage, Alzheimer's is very rarely diagnosed. Stage 2 of progression is marked by a significant decline in memory function and the beginnings of a personality change. There is difficulty in remembering the names of new acquaintances, difficulty in remembering items which have been read, and difficulties in organising and planning. Towards the end of this stage, the symptoms become more and more evident to others around the individual. A small proportion of individuals are diagnosed with Alzheimer's at this stage. By stage 3 of the disease, individuals are unable to function without assistance. There is great difficulty in remembering information such as their address and phone number, and sometimes even the date, day of the week or month. While they may be able to remember the names of people near to them, they forget the names of those they see on a less regular basis. They may often not recognise their surroundings. By this stage, a significant proportion of patients will be diagnosed. In stage 4, patients will be required to help with most of their daily functions. Personality changes also become evident, and there may be expressions of inappropriate emotions. Patients can still distinguish between familiar and unfamiliar faces, but have difficulty in identification. They can wander off and get lost, if not kept under observation. Frequently, they may need help with their bodily functions and can become doubly incontinent. They appear lost and confused for most of the time, though there may be periods of lucidity. The final stage of the disease is characterized by a catatonic-like state, which means that patients are unable to speak or respond to others, though they may occasionally utter words. Their muscles become rigid, and they are unable to sit up, smile, swallow, or hold their heads up. Death eventually intervenes, typically around 8 years after the initial diagnosis of Alzheimer's.